Dr. Chen, with Arrhythmotech, the Innovation of the Year, congratulations.
Thank you.
Talk about, if you would, the new ECG system and just give kind of an overview for those of us not in the field. What does this platform do?
I assume everyone knows what is the ECG. It's the electrocardiogram which picks up the signals from the heart. Heart generates a very large signal on the skin, measured in millivolts. But the skin also have nerves, which generate very small signals, measured in microvolts, which is a 1,000-fold difference in terms of voltage. So the technology is to be able to record both using filtering techniques so that we can see both ECG, and then in the same signal stream, we can eliminate the ECG and see the nerve activity. So it's a method to see both, using one single recording to see both ECG and the nerve activity at the same time.
And why is this important to do? What does this provide for patients or for medical caregivers? Why is this so important?
The reason is the nerve activity is very important in controlling bodily functions, such as in the heart. It controls the contraction of the heart, as well as the heartbeats, heart rate. And in disease condition, the nerve activity can trigger arrhythmias or heart rhythm disorders, such as atrial fibrillation or sudden cardiac death. With the availability of this recording technique, we hope to, detect which patient may be at risk of developing heart rhythm problems. Number two is to provide non-medical use as well. For example, people who does exercise, they like to know their heart rate during exercise. They may also want to know what's their sympathetic nerve activity during the exercise. And there are other possible applications such as lie detecting test. You know, people tell a lie and they cannot control their autonomic nervous system. And there will be a nice way, this will be a nice way to detect whether or not the system is activated.
It seems like a lot of the health use or the medical use of this kind of goes with the trend of preventative treatment, like you said, finding out who is at risk. And that's a really important trend in the medical field, right?
Yes, risk stratification is very important because there are methods to prevent, for example, sudden cardiac death, but we cannot use those methods, such as implanting a device in everybody walking on the planet. We have to be able to find those people who are at high risk or having sudden cardiac death to implant those devices to be medically feasible and cost effective.
I understand you're beta testing around the globe, right?
Yes, we have multiple collaborators who, both in US and around the globe, has been testing this idea. And some of the preliminary results will be presented in the Heart Rhythm Society meeting in 2 weeks.
And then finally, I know funding is always a big issue, but you've been able to attract some pretty good funding for this as well.
Yes, our research laboratory has always been funded by the National Institutes of Health. And very fortunately, we were able to attract 2 cycles of grant to develop this technology. So currently, Arrhythmotech is supported by an NIH funding mechanism called STTR. And we have both phase 1 and now we have a phase 2 funding to develop this technology.